care of children. People are having issues pertaining to how to run the house. Health is being the most important. Lot of insecurity and lot of melancholy, lot of sadness, anxiety outside. So there is a constant fight which is happening in our body and mind. How to manage things outside, how to manage things inside. How is the government outside? How is our internal government inside? So all this is causing a lot of issues. So what happens over here is that because of this constant struggle, what is happening? End of the day, we are after all a simple human being. Aam Admi, a mango man. End of the day, we get defeated in this struggle of current situation. So on losing the battle, what happens? The mind and body, we still try to struggle more. What do we do? What best can we do to cater our needs? So what happens to the mind? There's a lot of impatience, there's anger, there is anxiety, there's apprehension. What is going to happen? If I take vaccination, what is going to happen? If someone falls sick in the house, what is going to happen? And there's a constant OCD created. Sanitize, wear mask. It's good. But sometimes anything over and above, people are getting too worried about it. What am I supposed to have? Old parents in the house, I have small children. They end up with alcohol, smoking, and beverages. But what happens end of the day? The body. So mind has got into an issue. So what happens to the physical body? So there's a lot of headache because of constant stress, anxiety, tension, impatience, a depressive mood created across and in the house, watching news channel, IBS, diabetes, sitting at home, eating, no exercise, obesity, hyperthyroidism, irregular menstruation in young girls, women, cardiac issues because of constant tension which is created. Now, why am I telling all these things before? So let's try to assess what is happening here before we move forward and try to see what best our beautiful homeopathic science can do for us. Why homeopathy? Why not other systems of medicine? Homeopathy is the only and very modern scientific system of medicine which has a complete relation between the mind and the body. So here we try to study both man as a whole, including his mind and the body constitution, in understanding the individual and trying to assess his illness and how his mind is reacting, how his state of mind is. So this is one system which deals as a whole. So we are a holistic system. So now let's try to study more in detail. And as we are homeopathic students, I'm still a student because I learn every day. And as doctors and students, this is something which we study. This is something which is taught in colleges. This is something which we preach every day. How we do a case taking. Our case taking has to be a detailed case taking, which has been taught to us by our professors, which is written in our organ of medicine, the guidelines. All those has been mentioned to us pertaining to how a case taking has to be done. Unprejudiced, total observation, keen observer, all these have to be there when we are drawing a case. We need to stress on importance of a past history. What are the phases? Now, past history is not something that the patient would have had sinusitis, patient would have had a tonsillectomy, appendicectomy. Apart from that, what is that past history? We need to assess the life space of a person. He is currently in this situation, come to us for his physical ailment, but how was his mental state earlier? What is that change of disposition to what he is there right now? All this comes under past history. Because in colleges, we write past history as suffered from allergic rhinitis when he was 5 years old, and all those is suffering, has been a past history of hypertension. No, that is also important, but these are more important. Personal history. So personal history gives us importance, as we all know as homeopathic students and doctors. Personal history would indicate how are his bowel movements, how is his urination, how is his appetite, all these answer physical ailments. Sleep, how is his uh, appetite and thirst, thermals, all these are important which come under the personal history. Family history is important for us to understand the genetic makeup, the miasmatic makeup of a family. Now coming broad classification, illness can be categorized into two, acute and chronic. This is general. And at any given point of time, this is something which I would like to stress many a times, diagnosis. Now, as we homeopaths, it's very important for us to diagnose a disease. Of course, we would say we diagnose a person, and that is what is our principle. So we have to do individualization. For us, prime importance is man as a whole, irrespective of the nomenclature of the disease. But disease diagnosis is important. According to aphorism number 3, what knowledge of disease is also important, which has been told us in our organ of medicine. So knowledge of disease is important for us to understand what is the state of disease, prognosis, what is the type of treatment protocol is to be taken, a fast-acting medicine, a long-acting medicine, what type of family-related medicine to be introduced, how is the posology, how is the medicine, what potency. So it can go on and on. So apart from disease diagnosis, we need to individualize. Now I'll come to it shortly, but disease diagnosis is very, very important. So every time you get a case, please make sure that you would diagnose the disease. As we are doctors of the modern medicine, most scientific system of medicine today, it is our prime duty to diagnose a disease. Use laboratory findings, try to understand the disease in general, and try to find the diagnosis. Then comes the homeopathic aspect, the most difficult, because we are studying the proper side. We are studying all the things pertaining to the proper side, pathology, surgery, general medicine, the anatomy, physiology, everything. And then we also study the homeopathic subjects. For us, so it becomes homeopathy, I would rather put it as a super specialization, because for us, individualization of a patient with the disease knowledge, so you are actually more supreme than anyone else. So this is something which is very, very important. Now coming to the main part, individualization. How one person is different from the other. No two persons are alike, not even twins. Even a twin is not same. They have different characteristics. Physically, they may appear same, but mentally, their characters, mannerisms, everything is different. So now how do we do individualization? Is by understanding the personality and the temperament. Now, what is this temperament? So temperaments are nothing but a combination of mental, physical, and emotional traits of a person's natural disposition. So what do we understand here? A temperament is nothing but a predisposition, instinctive nature of a person to react to a certain stimuli. In a particular situation, a person would instinctively, basically is not in his conscious, it's an instinctive, it's a reflex that he would portray himself in that particular situation. This is a mental state in which he would show his behavior on. So temperaments are not caused by proving and are not changed in any manner by our remedies. However, are well indicated by symptoms found in persons of marked temperamental makeup. This is being told us by Dr. Kent. So our medicines are not going to do anything to the temperaments within us. We are all born with our own temperaments. So this is something which can never change. This is an instinctive body reaction. So even nothing would be changed during drug proving, nothing will be changed if homeopathic medicines. Oh, I don't like this temperament, I want to change my temperament. No. At any given point of time, you will be, because you are born in that temperament. So let's study more in detail of how to understand these temperaments and what are the types of temperaments. So before that, I would like to just show you a small slide, just an image of how a person's instinctive reaction. So it's a small cartoon image, how two people are reacting to a certain stimuli. The stimuli over here is a person wearing his hat and he has kept it on the bench aside him. Another person sits accidentally on it. A choleric person gets angry. How dare you sit? So that is an instinctive reaction which comes sudden. So here, this choleric temperament is anger driven. So next temperament, phlegmatic. So this person sits on this hat, but he's not bothered. He would rather, and the other person, he gets up. Oops, I sat on your hat. That man doesn't bother. He just picks up his hat, wears it, and he continues. So this is phlegmatic. Melancholic. So this person sits on the hat. Oh no, this is my precious hat. How have you done this to me? I feel so bad. This is something which was my favorite. And look, it is destroyed now. Sadness, which is getting created here. This is melancholic. Sanguine. So person has sat. And what is the reaction, instinctive reaction? You sat on my hat. Oh, look how it has become now. So they bring out a laughter out of everything. So this is such a nice way, a small cartoon presentation can, for us to understand how these temperaments are behaving instinctively with just a small picturization of a hat. All right. I hope this is a little clear. I would like to go on to the next slide now. Now, why take these temperaments? As I explained, these temperaments are general to the patient. So when we study organon, so we study about characteristic symptoms, physical generals. So temperaments are mental generals. It never changes. It is in our subconscious. It helps in arriving at the simillimum more fast. It helps in selecting the medicine after repetization. So many a times what happens, now this temperament is something which is already there since many, many years. Even before homeopathy, temperaments have been there, and it has been used in different medical systems, in psychology, in many aspects. But then in homeopathy, there are a lot of medicines which have been grouped under these temperaments, because our medicines, when proved, have shown these temperamental states in those medicines while proving. Now, we as homeopaths have a lot of weapons with us to treat. The classical way of treating, the Boger style. Boger gave importance to concomitants, modalities. Then Boric way of prescription, more of particular symptoms, fast prescription. Clark and Hahnemann, more detailed, where you study the drug more in detail and you use them as source books. Keynote prescription, you have few important medicines and you prescribe. Herbert Roberts says 3-legged stool. 3 characteristic symptoms are sufficient for us to come to a simillimum. There are many people who would prescribe on biochemics, Schussler's methods. There are many homeopaths who would prescribe on classical methods, constitutional methods. So many people who give importance to particular symptoms. Likewise, temperamental analysis way of prescription is involved in the whole of case taking, but sometimes it helps us in fast prescription. If you can arrive at the temperamental state of a person, our repertorial books and metramedicals have given us information of medicines which command each temperament. So we have a vast classification or group of medicines which we can use. It's handy. It's like a repertorial. So we have a set of 20-30 medicines. So the sanguine temperament person, so we have sanguine medicines. It's easy for us to pick this or that than studying choleric, melancholic, and a vast area of medicines, because we all know there are so many medicines which can be treated for the same condition. So this helps us easy. It helps in selecting the medicine after repetization. Sometimes after a repetization, temperaments help us in selecting the right remedy, this or that. Now, finally, after repetization, you may get pulsatilla or naxomica, but the person is phlegmatic, so you would give pulsatilla. The prescription is better, stronger, fast, and action is fast. It would increase the weight of our prescription. It's a keynote prescribing, as I explained. So there's a group of medicines which we would have, and that would help us in arriving at the medicine. then it's easy to extract the information of a patient. You just have to be a very keen observer. And how do we do that? As we all know, which is very important, Dr. Hahnemann has stressed in the organ of medicine that we need to be unprejudiced and a keen observer while taking a case. How is the entry of the patient? Does he knock? Does he come inside the door hurriedly? Would he ask permission? There are many people who are very different. When you start studying a man, it as is in general, his gait, body language, all this is very important. How he would draw the seat. He will pull the chair, he will pull it forehand, he will put it sideways, or when he goes, will he put the seat again back in the right position, or will he just push it away and walk out? All these are small observations which we need to observe. How he would sit. Would he sit very back, relaxed like a king, or would he be very anxious, come and sit, put his face right in front of the doctor, or would he peep inside the doctor's prescription pad to see what the doctor is writing? That is anxiety. So would he look at the doctor in a slant way, think whether this doctor can really do something that none of the other doctors could do? Suspicion. How does he talk? Introvert, extrovert. Does she put up the talks properly? Are they being very reserved in their speech, or is he a talkative person? All this. So all this is very important when we assess. Check the response to your question. So when you ask a question, will they answer to it immediately, or they go very vague? Doctor, you know what? I had gone to this doctor. I was in this city. Now you would have asked a specific question, but they want to add on stories. And then what do we see? We need to assess the intellect. How is the person responding? Is he in a position to understand your question? Is he in a position to interpret it better? Or you need to answer, question them repeatedly 2-3 times to ask the same question. Sometimes they don't understand immediately. You need to see their behavior in the clinic. How are they behaving? What kind of clothing are they wearing? How are they presentable to a doctor? How much of changes and observation is something which is very, very important. That few minutes that a person would spend time in your consultation hour is very, very important. Many a times, silence, just by observing of how the person would sit, react, gives us a lot of information. Because many a times patient is in a hurry, you are in a hurry. So just by observing these fine, keen movements, or sometimes you need to observe, probably if you have a CCTV camera outside, or you have a small window outside to see the waiting room, you should be in a position to see if a person is being restless, watching the time constantly, or the patient is moving here or there. Is he been laughing loudly? How he's sitting relaxed than sitting in front of you? Or is he very much of anxiety in the waiting room? All these are very important for us to understand and assess his mental state and help us in doing a proper case taking. Now, coming to the types of temperament: sanguine, choleric, phlegmatic, melancholic, bilious, lymphatic, nervous temperament. So these are the types of temperaments that we have in homeopathy. Now, let me go one by one in understanding each of these temperament more in detail. So, sanguine as a temperament. Now that I just explained you how the situation of a person is, now let's understand how are his positive traits and let's understand the negative traits. So sanguine, a person who is very lively, sociable person, a person who's very extroverted, very optimistic, leadership quality, confident, spontaneous reaction of a person. So what happens to this person? When this person is on stress, or when there's a slight change in his instinctive reaction, what happens? This person becomes emotionally unpredictable, very impulsive, disorganized in approach. Domination is seen, lack of willpower, anxiety, fear comes into this kind of a person. So now I'll go a little slow. Now I'll be explaining you a few of the characters, and then I'll be explaining you the personalities which belong to these. So these are some of the positive and negative traits. Let's try to understand each temperament and two temperaments together. So now we have understood sanguine being extrovert, lively, social. Now this person is someone who you can imagine a college boy, okay, or a girl, so very popular among the group, would flirt around, have many boyfriends, girlfriends. He's or she is very talkative, magnet kind. They get attracted everywhere. So full of life, energy. This is a person of sanguine. This person gets angry immediately, impulsive, because they are so full of life, full of energy, that they bring out emotions exactly opposite. So when they're fully in energy, lively, talkative, suddenly they become angry, they become very impulsive, sudden impatience, they become disorganized. So, but this is a very strong constitution, extroverted, and very positive minded temperament. Now, let's understand another temperament called as choleric. Choleric is also an extrovert. They're born leaders, aggressive, impulsive, optimistic, strong willed, fastidious. So we see two kinds of people. One, someone who is like, as I said, the sanguine who is popular in the group, like a hero or a heroine. Choleric is like a boss or a gang leader. So these are people who control. They're extroverts. Top CEOs, administrators, optimistic, strong-willed. Any difficult situation, they go headstrong. They are in a position to handle it much, much better. And they're very competitive, industrious. They want to achieve. These are basically high achievers. They want to win over things, conquerors. They are cholerics. But what happens to them? When they are bogged down with a lot of stress, tension, there's a lot of restlessness, they are anger prone, they end up with a lot of superiority complex. So many a times we see superiority complex when someone tries to outbeat them. Now they get imagine a sanguine person and a choleric person together. Now sanguine will say, hey, maybe a hero, but I'm the best, I'm the boss. Lacks sympathy. So they become headstrong. They would not go by emotions so easily. They become sarcastic, hypocritical. They would say something but do the exact opposite of it. Because end of the day, they want to run the show. They cannot bear contradiction. Now, any junior would try to explain something to a choleric person who is superior, will not take it. Cannot bear contradiction. That would anger them immediately. So what I'm trying to say here is, so let's not take everything in a good way. So I've explained you something which are good, something which is bad. So here we can see a person who could be having superiority complex, who could be sarcastic in his approach when he comes to a clinic. Kya doctor, aapko, he will say, you say so many things in the news, they say so many things about homeopathy, and then and you people say, so there's so many things which they try to criticize. But when you try to, that is very important. So you need to conquer your patient. You need to take your patient in confidence. So that is all art. So that's why we say homeopathy is an art and science. So art is case taking, science is homeopathy. So it all depends on how good your approach is. Control the patient. Never let the patient control you. Whoever it may be, however big may be. He has or she has come to you, that means you are bigger than them at any given day. So always take confidence. Never ever lose confidence. Never ever doubt yourself as homeopaths. We should be in a position to be superior to all of these. So when you do that, you are in a position to handle anyone for that matter. Now, sanguine person may start talking continuously. You need to apply the brake. Control. So you need to assess. Now, what I'm teaching you is, as because I'm a clinician, so I'm teaching you both ways, academics and how to handle in clinic. So these are some behavioral patterns which you would see and how we need to assess them. Now let's see. Now, what do we see here? Very famous Kareena Kapoor. So Kareena Kapoor belongs to the sanguine temperament. If you all must have seen the movie. I'm going a little offhand because this is how we understand temperaments better. So you all must have seen the movie Jab We Met. Lively, full of life, energy, talkative, impulsive nature. Suddenly she runs out of the house. So this is what is sanguine. So now you're in a position to assess, understand how these small tabular forms of characteristics which I explained with the personality, what you would have seen on the television. So this sanguine as a constitution is very hot, moist. Physically, they are barrel-chested, muscular. Red complexion is so much. So you must have seen when Kareena Kapoor is excited or emotional in that movie. There's so much of red complexion which is seen. Very active, optimistic, full of passion. So there are many personalities. I'll just name a few personalities before I go forward to the next point. So there are other personalities which come to my mind of these sanguine temperaments. So you all know the movie Three Idiots. Amir Khan plays a role of in that movie where he is of a temperament of sanguine, full of life, carefree, very lively, sociable, and takes everything in an optimistic way and win it. And then we would also see many other personalities, something like the very famous James Bond series. The movie of James Bond, generally the temperament is of a sanguine character. If I have to put across some other personalities, you all know the very famous cricketer Yuvraj Singh. Yuvraj Singh is sanguine. Then the current wicketkeeper, the very famous Rishabh Pant, for his heroics in Australia. So Rishabh Pant belongs to this kind of a category of sanguine. There's another very popular movie called as Zindagi Na Milegi Dobara. Hrithik Roshan. Hrithik Roshan and Farhan Akhtar have shown traits of sanguine in them to an extent. Next, let's move forward. So we see common physical ailments. Now I think you're in a position to understand these temperaments. So I just give you a small insight to types of temperaments so that it sits better. Because visualization with the academics, it goes better. Common physical ailments. So now this temperament shows a little common physical ailments. So these people generally suffer from cardiac issues, hypertension, palpitation, respiratory problems, diarrhea, skin dermatological issues, hemorrhage. So hemorrhagic diathesis patients are all majority sanguine related. So you may see a lot of patients who would have these physical ailments. When you assess their mental states of these temperaments, you are in a position to understand things much better. Now there are a group, as I explained, there are a lot of group of medicines in homeopathy which belong to these temperaments. So drugs like aconite, coffea, ferrum. Now ferrum is a very strong-willed person, optimistic. But then one thing important in ferrum is they're defensive. They may go strong, but first self-defense, see if everything's okay, then they go forward. The other important sanguines would be, most characteristic would be phosphorus. So phosphorus, when you study phosphorus, you will see how nicely sanguine temperament is. Phosphorus, hyoscyamus, extremely talkative, full of life, optimistic. Veratrum, stramonium, you have ignitia, impulsive. So and Naxomica to an extent. So all these are traits of sanguine which you can see. There are many more medicines. I have just given you a small group of medicines. When you start studying in different repertories, there is a whole list of medicines which come in different grades, 4th grade, 3 grade, 2 grade, 1 grade. Many medicines which belong to these temperaments. I've just listed out a few of the temperaments. So let's move forward and try to understand, now that we've understood sanguine, how the physical constitution, how the mental state, their reactions are, their behavioral patterns, and we have studied some of the medicines of homeopathy. Now let me take you forward for choleric temperament. Now, what do we see? Shri Narendra Modi, our beloved Prime Minister. Choleric temperament. Choleric temperament, why? Strong-willed, leader-prone, extrovert. And then what do we see here? So this kind of a personality who takes everything, administrative qualities, able to manage everything, taking things forward, extrovert. So all these are common traits. Now, again, I would like to put a disclaimer here. It's just because many people have different ways in which one would see and assess people. This is some of my personal observations. So I don't want anyone to take anything differently just because I've used our Prime Minister over here. It's only because for us to understand a personality of similar characteristics, I've used him as a reference over here. Now, apart from him, we have general administrators. So any institutional administrators, owners, managers belong to this group of choleric temperament. So we have the very famous big boss, Salman Khan. Salman Khan also comes to the choleric temperament. His body language, his way of speech. And the very famous cricketer, TV entertainment person, now a politician, Navjot Singh Sidhu. Sharp, witty, immediate. So we see Navjot Singh Sidhu. And then we have another common, wonderful personality which we have, that is the very famous Talaiva, that is Rajnikant. So Rajnikant in his movies, you must have seen, he portrays these kind of personalities where he makes the world revolve around him. Winner, leader quality, extrovert, takes things to their stride and try to make things happen. So apart from them, few more examples, if I have to give you, all must have seen that Indian Idol. You have Anu Malik. Snapshot in his judgment. Good, bad, on the face, straightforward. So those are choleric people, choleric temperaments. And then, so let's see. Now the constitution of choleric would be, they are dry, rectangular or square body constitution. So they have tight connective tissues, yellow complexion. They are prone to anger, irritability, impatient. Now these personality people, choleric temperament, have a sphere of action on the liver, the gall and the liver specific. Digestive and alimentive systems of our body. They can have insomnia and gastric problem, burning in the cardiac region of the stomach. So these are the common ailments which a choleric temperament person would suffer from. The common drugs for choleric temperament would be acid floor, Oramet, Bryonia, Chamomilla. Again, Ferromet also shows characteristics of choleric, strong-willed, optimistic. That's why. We have Kali Khab. Kali Khab is a person who would be sarcastic, never okay, never happy, and always tries to pinpoint. Lycopodium. Lycopodium personality is superiority complex. So again, Lycopodium shows high characteristics of choleric. And then we have Natramure, Acid Knight. Acid Knight, again, a lot of choleric temperament personalities where there is extrovert, there is optimism, there is a lot of impulsiveness, impatience, and nitric acids are revengeful. Nakshamika, boss. Nakshamika is the boss. So we see Nakshamika people, again, highly industrious. When you try to compare a calcarea and a Nakshamika and an arsenic, Nakshamika is something like a boss. So he would try to make sure things are done. Calcarea carb is more relaxed, not competitive. Nakshamika, competitive, achiever. But he would do and make sure others do. Arsenic, he will do and continuously keep doing. Fastidious nature. Another very important medicine over here is oleander. Irritability, impatient, sarcastic, pinpoint. They are never happy. They always try to pinpoint on things. Oleander, very beautiful medicine. Platina, again, high superiority complex. I am the boss. Look down on others. Take things forward. They are the best category of medicines we see in Platina as a person. So there are so many medicines which we would see in choleric temperament. There are many more, as I explained. In other repertories, there are many more temperaments. Uh, in many more temperaments, you would see many medicines in other repertories. Now, moving forward, let's try to understand the other two temperaments. Now that we have an understanding of how a sanguine and a choleric temperament with some small insight to some personalities, let's see how phlegmatic is. Now, phlegmatic is very introverted, careful, thoughtful, reliable, calm, nothing would ruffle their feathers, dependable, easygoing. Now, this person is someone who is an introvert. He's very reserved in his approach. He's very careful, very conscious about what he is doing, how he would do it. They would think before. So these are people who think and act. The first two is act and then think, because both are impulsive. Here, think, act. Very important to differentiate the first two and this. Very peaceful and calm. Nothing would disturb. As I had shown you that photograph, someone sits on his hat, he's not bothered. He would still wear that broken or a compressed hat again. Very dependable people, very easygoing. Now, what do we see when these kind of people, personality, go on a bit of stress or how they show negative traits? So these people are couch potatoes, very lazy. Satisfaction is very fast for them. They're content. They don't want to go into high competitive zone. They're relaxed. Negativity is fast. So they go into a negative phase, a depressive phase fast. They would neglect their duties. Uh, आज नहीं तो कल करेंगे, कल तो some other time. They lose self-esteem very fast. Oh, I don't know if I can really do this. They tend to be an observer. So in a competition, so these are the people who would not come front. So you would see if there's a people of arsenic, naxamika, and calcarea carb and pulsatilla. So you would see a naxamic and arsenic lift their hand immediate. They want to go front. Calcarea carb, pulsatilla, they relax. So these are the kind of instinctive body reaction of these people. Unless they are coaxed or when it really comes to the neck, they move forward. But otherwise also, they are not ordinary. They are achievers. They're dependable at any given point of time and very strong constitution. They lack enthusiasm and then they hide their emotions. So someone tries to come and do a prank, did someone try to tease them, they would not react immediately. So this is how a phlegmatic is. Now let's understand melancholic. Melancholic is a very introvert personality. Responsible, trustworthy, weeping of the heart, talented, sensitive, self-sacrificing. Now here we have a personality of a person who is very introvert, who is very responsible, who thinks a lot before he brings into any action, very conscious in his actions. If I do this, will it hurt anyone? If I do that, will it hurt another person? So they think a lot before they bring out an action. What they would analyze, assess before an action. Very talented people, but they don't come forward immediately. They try to take the name, they try to take whatever name created for them in the background. They never come front. Self-sacrificing, father kind of personalities. They always try to sacrifice whatever they can so that they can bring out the best for others. So this is melancholy. What happens to this melancholic people? Something really disturbs them. These people are strugglers. I would rather put melancholic are strugglers. So when the struggle becomes more and more difficult, they become more depressive. They become more obsessive they want to do the same things again and again. Routinist, I would rather put them. So they don't like changes. They would like to keep it simple and same every day. I go to office in the morning and I come back in the same time. No deviation, no anywhere. Come back, sit, eat the same food, sleep. They are routinists. Oversensitive, they become suspicious when things don't go their way. Indecisive, they're not in a position to decide on things. They become conscious what one thinks about themselves. So all these puts together for us to understand how a melancholic is. Now let's try to understand some personalities. First, we'll start with phlegmatic. Our very famous, the god of cricket, Sachin Tendulkar. Dependable, the achiever who conquered the world of cricket. So apart from Sachin Tendulkar, the another reliable, the most reliable person, the wall, Rahul Dravid, also comes into the category of the phlegmatic. So as I said, they're not competitive, they are, but they take things their own way. They don't get disturbed by a comment. They don't disturb about how what other person thinks about them. They know their goal, they would finish it. They're achievers. We have other cricket personalities also, Pujara, and then we have Ajinkya Rahane. All these people belong to this category of. And then you all must have seen this movie called The Hera Fairy. It's a comedy Hindi movie where Paresh Rawal has played a role in it. Now, Paresh Rawal is phlegmatic, relaxed, carefree. Let it happen. If not today, tomorrow. Let's not worry about things. Couch potato. So you can understand, assess how the personality is moving over here. And then we have another very famous personality which comes to my mind over here is Mother Teresa. Also comes into the same characteristics of a phlegmatic category. So here what we would see, the physical constitutions would be round oval body constitution. They're very fair and then sympathetic, sensitive in nature. They're very, there's a lot of fearfulness, tearfulness, sadness. The constitution, again, there is a lot of rheumatic complaints which are seen in these people. Constipation, they sleep more. Anesthetic, so pain, they're sensitive to pain better. So it has an action on the central nervous system, it has an action on the lymphatic system, the lungs, genitourinary system. So the common medicines, what we would see here is ammonium carb, antium crude, capsicum, china, pulsatilla, thuja, all these medicines. Now, how are these medicines grouped in these repertory or are metamedicas? Because these medicines, apart from their other characteristic symptoms, they share the same common mental symptoms and states which belong to these temperament. Now, since these belong to these specific temperaments and states, it has been grouped by the doctors and pioneers of our system. They have assessed it and then entered into these repertories. So it has actually made our work so simple that we have ready information. As I told you, this is a weapon, one of our weapons. So we have something and information is already there. It's just that we have to use them for our best. I would not say use it in all your cases. Use in majority of your cases. It helps. Now, if you're a busy clinician seeing number of patients, these temperaments help you in assessing them, selecting them fast. Let me go to the next personality or the next temperament. So now we have understood phlegmatic. We have known few personalities of how they are, what their physical constitution is, what are the medicines. Now let me move forward to the melancholic. Captain Cool, MS Dhoni. So what do we see here? Very calm person, relaxed, thinks before action, self-sacrificing, dependable. So all these are common traits of melancholy. So these are things which we would see very, and then other personalities. Now let me come to that. So other personalities, what we would see, what I have assessed, Bhagwan Buddha, comes under the category of melancholic. Father of our nation, Mahatma Gandhi ji, comes into the category of melancholic. We have another movie which I can again narrate, is Three Idiots. It's a wonderful movie where the temperaments and the personalities are portrayed very nicely. So here Madhavan, who plays another character in the movie, shows a temperament of melancholy. Now we have seen, what I could assess of late is Sonu Sood, the recent personality. Of course, he's been there in the movies for a long time, but his actions apart from on screen, off screen, his interviews, his approach to the public is making me assess his temperament towards melancholic. Usually has a cool, dry, thin body, pipe stem, bones, ashy colored complexion, very intelligent, very sophisticated. Another person which comes to my mind is Amir Khan, also comes into this category. Prone to pensiveness, restless, depressive nature, which comes to the negative state. Common physical ailments, has a quick action and is associated to the nervous system, lungs, and spleen. Now, I would just like to make a small remark here, since it's the COVID-19 situation across, and it's a melancholy everywhere right now. It's a world full of melancholy, world full of sadness and tension, anxiety, depression, worry, insecurity. What happens? People are worried about health first, then money, how to take care, what is about the future. And that is why, because arsenic alb is selected over here as one of the prime medicines for treatment, is because arsenic alb is melancholic, and melancholic is what we are in today. Today is, apart from being the psychotic world, psychosyphilitic, I would rather going into the world outside. Arsenic alb is a medicine which is very suited. Why it has been selected? Apart from it has its action on the lungs, arsenic alb is a very predominant medicine for melancholy. But as I was explaining, arsenic alb or Kali group, which is again, and embragracia. Embragracia is also suited now for COVID-19 and melancholies, because these have a spear of action on the lungs, and we are seeing the cough, the type of cough seen is a lot of embragracia medicine has helped a lot of people in taking care of the type of cough, the lung involvement. Kali group of medicines have been successfully used, prescribed in this situation, because Kali is a person who is not as fastidious as arsenic. I would rather put Kali as an Indian father or a husband. I would rather put it. Tries to balance everything, gives his best, trying to work hard. Routine person, a typical Indian father, husband, who wants to do everything in the routine, take care of things, but always irritated with the family members. Not that he's angry on them, but there is some place where he can vent out his emotions. So Kali is one person like that. And then he tries to give his best, as good as arsenic, but not to that level of being a fastidious, a perfectionist. Tries to do, but cannot. But again, he cannot sit dull, relax like a pulsatilla or calcarea carb, content also. So this in between is Kali, which is melancholic. Again, we have pulsatilla, staphysagria. Staphysagria, mind now, person who is in this kind of a category and he doesn't show his emotion. Now, these are people who don't show emotions outside. They hide everything to themselves. Suppression of anger, staphysagria. And then we have other medicines, specifically the LACAN, LACDEF, the LAC group. This again group of medicines show a lot of mind in the negative phase, a lot of depression, impatience, not content about things, so insecurity, worried, anxiety, apprehension, future. Now, arsenic alb is something which thinks there is no cure. People think that they're going to die. So this is our traits of arsenic alb. So this is how we can assess. That is why currently what I'm saying is arsenic is melancholy. Now let's move forward and try to understand the other temperaments. Bilius. Now bilius temperament is Again, I would rather put it as something similar to choleric. Now let's try to assess them a little more upper in than choleric. Extrovert, bitter, ill-humored, aggressive, quarrelsome, anguish, very timid in nature, administrator, a bigger boss, I would rather say, pertaining to bile. So action on the liver is more strong, on the gallbladder is more spiteful. They are someone who are fault finders, immediate, straightforward, instinctive reaction. Person who is an aggressive achiever. I would rather put choleric is an achiever, but this is an aggressive achiever. Bitter because they do not think what the other person thinks about it. So someone would cook something for them. Salt is less in this. This is not cooked properly. Oil is less in this. Whether the opposite person feels bad or not bothered. Immediate reaction, aggressive and quarrelsome. So immediate there is a reaction of this person is bilious. So what do we see here? The personality, the very famous, our Indian captain, Virat Kohli. So Virat Kohli comes into the category of bilious. This is all my assessment. Please don't take it personal. So bilious, so all kinds of directors, administrators, presidents, principals of institutions, CEOs of companies, top managerial, top decision makers in the world are bilious categories. So these people are recognized by dark yellow skin, predisposition to derangement, irregularities in digestive system. They are more prone to constipation and piles because they have a lot of sedentary lifestyle. Action on the liver, gallbladder, a lot of digestive issues, digestive tract and acidity. So this personality is more prone for gastric related issues, GERD symptoms. So common medicines over here, which has a sphere of action on the liver and in the mind, who is very aggressive in nature, similar to choleric, but an upper hand, as I explained. Chelidonium, China, Naxomica, Merxol, sulfur, bryonia, cannabis, chamomilla, again calicab comes here, colchicum, lachesis. So all these are common medicines which we would see even in a bilious temperament. So these are medicines which can be used when you see this kind of a personality. We can use these medicines because it has a sphere of action on the bilious temperament, and they would have they would have some issue with gastric oriented symptoms. So this is how the body makeup is, and this is mentioned in our organelle, Metramedica and repertory. All this information is there so that we can understand these temperaments better. Now let me move forward to the next temperament, that is the lymphatic, or we call it as leukophlegmatic. These are called as, or the mucus type temperament. Sluggishness, mental and physical, lazy, anxiety, calm, peaceful, content, glandular affection, phlegmatic, insecurity, hesitant in nature, very cautious. So this personality is something similar to a phlegmatic constitution, but one step higher. So what do we see over here? This person is lazy, very anxiety, apprehensive nature, lot of insecurity, hesitant. Shall I do this or not? Move this, that, always in dual mind, indecisive nature, hesitant, and always hurried. I want to do this fast. And again, not in a position to decide on something. Always would like to take opinion from others. Yielding nature, would always bend upon either parents take a decision, friends take a decision, mentors take a decision, someone always takes a decision, always are dependable. They depend on people. So this is a person who's very calm, composed, relaxed. They are achievers. They do everything, but some given point of time, they have that insecurity and hesitancy. So I would just try to give you a small example of this movie. Again, same. Three Idiots, Sharman Joshi, and there's another movie which I've seen called as Pyari Ki Savari. So in this movie also, Sharman Joshi plays a typical lead in which he would portray a lymphatic type constitution, hesitant, doubtful, anxiety prone, apprehensive, whether I'll be in a position to do or not, worried about the future, worried about something, calm, content, all these are common. So this person is a light complexion, flesh, soft, flaccid. Patient is subject to slow, sluggish. They have a lot of cataract diseases. So they will be having issues pertaining to the ENT. So cold, runny nose, sinus, throat related, phlegm, all these are connected with the lymphatic. And this has an action on the whole of the lymphatic systems of our body. Acute diseases which go into a chronic state very fast. So they run a slow and tedious course. So it's not something like a sanguine and choleric where something happens to them, there is an immediate reaction. Now, what is aconite? Sanguine, aconite, when aconite falls sick, there is a big alarm. Oh no, I'm going to die. He would start taking the time of death. Anything, even the slightest strong, robust personality becomes very weak. Is sanguine. But lymphatic, they do not show reactions. They do not show the disease course is very slow. Baraitakhar, ferrum, graphitis, calcarea carb, indecisive. Again, hesitant in nature, not competitive, worried whether I can or calcarea carb is a very person who is very happy, content in his own shell. Anything slight change, first calcarea carb is save myself, save my family, then I'll think about others. So this is a constitution who would first think and then think about other things. So we have dysenterico, hesitancy, apprehension, argentum nitricum, gelsemium. We have kali ars, sepia, silesia. These are common medicines which we would think of in case of lymphatic temperament. I'll move on to the next slide. So the last temperament being the nervous temperament. This category of temperament is very excitable, apprehensive, studious, subtle, starts easily, bipolar, and they have high susceptibility, mental impressions. So these people are very excitable, very apprehensive nature, nervousness. Anyone would have seen these personalities many a times. You would see these people who are very excited. Once lightest things, they get alarmed very fast. High tension, high worried, anger prone. They can become very slightest things they get reacted. They doubt themselves, low self-esteem. All these are traits in which a nervous temperament would portray. So what do we see? Just a few things which I would like to say. So Alia Bhatt. So it's not that the personality of Alia Bhatt is like that, but there's a movie which was seen as Love You Zindagi. So Alia Bhatt plays a role in that, where she's a little on the nervous temperament, where she shows characteristics of that. There was another movie in which an old movie called Dil Chahta Hai. So Saif Ali Khan plays a role in that movie. So he's hesitant, jittery, his reactions. So someone else should show him, guide him what he has to do, what not to do. Just small common traits that we would see. Another movie is called as Karthik Calling Karthik. It's by the actor Farhan Akhtar. That movie also portrays nervous temperament very nicely. Characterized by extreme sensitiveness, excitability of mind and body. The patient is very liable to nervous disorders, and then reactions are very fast, spasmodic, nervous, neuralgic kind. So drugs over here we have is the magnesium group is predominant of nervous system, nervous temperament. Dysenterico, gelsemium, argentum nitricum, take everything to alarm, worried, anxiety, apprehension. These are all common symptoms of or states in which we would see in nervous temperament are also seen in the metramedicas of these medicines. So this is how, now that we have understood all these 7 categories of temperaments, now let's try to get back to how we would use these temperaments and what are these information. So now that we have understood these temperaments, so here one we have to make it very important is this is not connected to with the mental symptoms. It's the state. As I explained, this is a mental general. It is something which is general to our body. We are brought up, our it's our instinct, it's our subconscious. So it is a state of a patient who would show this reaction behavioral pattern. So to hold good, it has been uh, explained to us from the organ of medicine, aphorism number 211. It has been explained, state of disposition of a patient chiefly determines the selection of homeopathic remedy, and it is very characteristics. Footnote 213, it says, aconite is seldom, never effect a rapid permanent cure in a patient of a quiet, calm, equable disposition. So here we see this constitution where aconite will never act on a person who is very calm, relaxed, composed. So for a phlegmatic person, if you give aconite, it will not do the justice. Similarly, Naxamica to a disposition of mild and phlegmatic. So Naxamica will not act for a phlegmatic temperament. Pulsatilla to a happy gay. So pulsatilla will not act well, or the speed in which it has to show its action for the treatment will not happen for a person of a sanguine choleric than for a phlegmatic temperament. So all this is given in our organ of medicine. Moving forward to more on the information, using temperaments in treating different diseases. Now it is a boon for the homeopathic doctor that we are able to appreciate a person's temperament, which is very characteristic to a person, and we can use this for our prescription for the betterment of a person so that we can treat them better and they can heal better. To hold good, from the aphorisms 215 and 216, we understand that how a mind, when deranged, can lead to corporeal diseases. We have studied in our medicines about this aphorisms, how a mind, when deranged, can lead to physical ailments in the body. So mind is getting stressed and body is showing all kinds of physical ailments. So aphorism 215 and 213 helps us in understanding how this specific mental state of a person, when stressed and change of disposition leading to corporeal diseases, is given us, and this helps us in understanding the treatment protocol that we have to follow in treating conditions pertaining to the condition of the patient by the help of aphorism 215 and 216. Stress and lifestyle play an important role in the disease. So we need to always, so doctor is not someone who would give medicine. Doctor should always try to be a person who would try to first educate the patient, try to take care, remove the obstacles when maintaining causes, if required, prescribe. So that is how a doctor has to be. State of stress or mind is important when patient is first diagnosed before the illness. As I said, past history and just before the change of disposition is very important. Aphorism number 210, footnote, change of disposition can be known only by a keen observation and by good case taking. So this becomes very important as we homeopathic doctors and students. When we take a case, we have to be at utmost attention, keen observation, be unprejudiced. Try to, as I said, homeopathy is an art and a science. So you have to be at utmost artistic way in taking out the case, take out the information and bring out the best for the patient. We as homeopaths, we treat man as a whole, not just his organ, because man comes to us for curing him, not only his organ. So this is very, very important. This is something that we do every day. And the formula for the complete case taking or the totality of symptoms, mental general, the temperaments, physical generals, the symptoms of the disease, all these put together is complete picture of disease. Now that I've taught you temperaments, don't think I will treat only take the temperament and give medicine. No, nothing is complete unless we complete the formula. Totality of symptoms has to include physical general, mental general, the symptoms of the disease, and only then prescribe a medicine. Temperaments assessing is only an easier way to come into a cluster of medicine. Motive, no palliation, no maintenance of disease, but only cure. Aphorism number 1, which is the main goal for us homeopaths, which is our mission, that is complete cure of a disease for the patient. That is no palliation, no maintenance, but we should always strive to give a complete cure. Organ of medicine. All of us show one or more temperaments, but dominating by only one. So do our medicines. So that is why you could have seen many temperaments had similar medicines in them. So that is what I want to say. As miasms, psora, psychosis, syphilis, many of us show multiple miasms, multiple temperaments. So a person can be sanguino-choleric, sanguino-phlegmatic. He could be phlegmato-melancholic, or he could be cholero-lymphatic. So it could be a combination of these temperaments, but predominant in one. So domination. So 60-70% of the temperament is one, the other 40% is something else. There can be a cluster of 3 temperaments also in it, but there is a domination. Temperament is only one, which is an instinctive mental state of that person. And more important, no temperament is good or bad. As I explained to a lot of personalities, each one would think and try to assess. By now, many would have all assessed which temperament one would belong to. Now, I would want to say, I am sanguine, I am strong, extrovert, I am extroverted, optimistic, you are melancholic, you are depressive. No, each one is best. We are all children of God. We are all having our own unique temperament in us. So we are the best, and we have to make sure that don't ever think that what temperament types that we have tried to understand, it is for us to do assess in our clinics for the betterment of the patient. Don't think that this temperament is bad, this temperament is good. All are unique and all are special. Very, very important note. So I would like to conclude over here saying that we homeopaths, now this is very important, we homeopaths are expected to be phlegmatic, calm, composed, observing in receiving the case, sanguine, talkative, artistic, capturing the patient, sanguine, magnet, you have to capture your patient, melancholic in assessing it, completely try to understand, strategize, analysis of the patient has to be done through the melancholic. And then choleric, sharp, witty, snapshot in your prescription, never be doubtful. And at no stage we are expected to be nervous. So I would like to conclude here that this is all about the temperaments, and I would like to thank every one of you, all the participants, the faculty members, Dr. Vivek and Dr. Khushbu Gupta for this wonderful opportunity that you have given me for expressing a small insight to temperaments and how it can be used in homeopathic prescription. And this is a small piece of information that I could do in my experience. Thank you so much for patient hearing by every one of you. I am really humbled. Thank you so much.
Thank you so much, Dr. Rohit, for such a nice presentation over temperament. I hope this will be really helpful for all our attendees. Dr. Rohit, there is a question from one of our guests, Dr. M.R. Srivatsan sir is asking about that in this today's condition of COVID pandemic, you are not going to see patient and you are just consulting them online. So how can we judge about the temperament of the patient, and we can use that in our prescribing?
Again, as I was explaining today, being a little challenging times for us. So when we try to get a phone call of a patient, or we are doing a video consultation, or it could be just WhatsApp messages. So we need to understand how the patient is trying to portray himself. So the very next person would say he would sneeze and cough. Doctor, am I having COVID? Next question, doctor, should I test myself? So this is person is going towards.
I have a question from my side, Dr. Rohit. It's a funny one.
Please.
After going on through your lecture, I was listening to you very, very properly. I would like to know about your temperament.
I'm more towards sanguine or melancholic category.
Okay, then I was right. Yeah. Thank you, guys. Thank you, everyone. Now I would request our co-founder, Dr. Khushbu Gupta, to be present over here and present vote of thanks to our guest speaker today and other guests present over here. Over to you, Dr. Khushbu.
Thank you, Dr. Vivek. And thank you, Dr. Rohit, for such a beautiful lecture on temperament. I think all of us, all the attendees would have enjoyed learning temperament, and how beautiful you presented. It was visible to all of us. And thank you so much for agreeing to give your lecture right here at our platform, Learning Homeopathy. And I would also like to thank you, Dr. Arun Bhasmi sir and Dr. M.R. Srivatsan sir, for joining our platform and gracing this platform. Thank you so much, sir. And I would also like to thank you, Dr. Farhana. She's being a very good homeopath, and she's a very nice person, and she's also enjoying this lecture and being present here throughout the lecture. Thank you so much, ma'am.
So thank you, everyone. We will meet next week right here on Learning Homeopathy platform. Bye-bye, everyone. Take care.
Thank you so much. Bye. All take care.
Thank you, Dr. Rohit. Thank you.
Thanks. Thank you, Rohit. Best.